Patients having hyperthermic hemoperfusion may be admitted the day before surgery or the morning of surgery. If you are admitted the morning of surgery, you will receive a phone call from the DAS, the Day of Admission Surgery Unit, the afternoon before your scheduled surgery. A nurse will do an assessment over the phone and review standard surgical instructions such as to shower with an antibacterial soap, to wear comfortable clothing, to remove any jewelry, piercings, contact lenses, or nail polish, and to have nothing to eat or drink after midnight. She will go over any special instructions, such as a bowel prep if needed. You will be given a time to arrive, which is 2 to 3 hours prior to your surgical time. You will be instructed then where to park. You and your family will report to the Surgical Family Lounge on the first floor. Check in with a patient representative. She will have a patient service rep accompany you to the DAS unit while your family waits in the lounge. Once in the DAS, you will change into a gown and the nurse will do an assessment. She will check your consents, start an IV, and draw any blood if ordered. The nurse anesthetist and anesthesiologist will speak with you and you may receive a pain block. Once complete, your family will be brought back up to wait with you. You will be brought to the operating room by the nurse anesthetist. The circulating nurse will greet you, check your armband, and ask a few questions to verify your name, procedure, and allergies. She will transfer you to the operating room bed, which is narrow but padded with a warm viscoelastic gel. You will be made as comfortable as possible with pillows and warm blankets. Gently squeezing sequential compression devices will be placed on your lower legs to prevent possible clot formation. Once in the operating room, you will never be alone. The surgical team consists of the surgeon, the resident, the scrub nurse, circulating nurse, anesthesiologist, nurse anesthetist, and the perfusionist. They will work together to ensure your safety and privacy with professionalism and compassion. General anesthesia will begin soon after you arrive in the operating room. We will monitor and support you throughout the case. You may not remember the operating room at all, and once the surgery is complete, you will be transferred to the recovery room. When you are taken to the operating room, family members will return to the surgical family waiting room. Be prepared for a long wait, 6 to 12 hours. They may want to bring a book or computer. They should check in with the patient rep whenever they leave or return, and pagers are available to them. The operating room nurse will try to call every few hours to give an update, and the doctor will speak with them when the surgery finishes. They will receive a patient tracking number to check the progress of your surgery confidentially. The patient tracking board in the Surgical Family Lounge area will display when you enter the OR, when the surgery starts and finishes, and when you are in the PACU. No names are displayed, only the tracking number. Once in the recovery room, a patient liaison will make rounds and update your family every 2 to 3 hours. Your family may be able to visit you there depending on how long you are there. You will then be transferred to the intensive care unit. A catheter will have been placed in your bladder after you were anesthetized. A bag will collect urine, and you may have one or more drains temporarily placed in your abdomen. There will be signs on the bed for post-operative excretion precautions for the chemotherapy that you receive lasting 3 to 7 days. Gloves must be worn by anyone handling your body fluids during that period. Our committed staff has years of experience with these procedures. We are professional and passionate about caring for our patients. We understand what a challenging experience you are facing and will be your advocate throughout the surgery.